All right, everybody. Welcome to the 3 o'clock breakout session on the opioid settlement dollars. And really more importantly, it's going to be a tremendous introduction to the Maine Recovery Council, which I'm really excited about the potential there. Just a reminder, my name is Aaron Fry. I have the privilege of serving as Maine's Attorney General. And as you all heard me mention earlier, my office has been working for years at trying to create the opportunity that we have before us now, which is through work to hold accountable a number of opioid manufacturers, distributors, pharmacies, those who drove and fueled the opioid epidemic, which is ravaging our state and has for years. We now have financial resources as a result of these settlements that are going to be coming into the state over 18 years that are going to be available to direct specifically to abatement-related activities. And what you're going to learn about today is you're going to learn about the way in which we have structured to make sure that hopefully these funds are going to be directed and used to their maximum possible benefit. Real quick, there's 3 different pots of money that you're going to hear about. Some amount of money that goes to the Office of the Attorney General. I'll talk about that in just a second. Some money that goes directly out to certain political subdivisions. Those are counties and certain municipalities here in the state of Maine. And a bulk of it, 50% of it, goes through the Maine Recovery Council, which, again, you're going to learn some really good information about today. Let me highlight the Maine Recovery Council and what I'm excited about. First of all, we watched what was happening across the country in terms of how these dollars were hopefully going to be maximized. And what we were able to do here in Maine is we saw an opportunity to bring a broad range of stakeholders to the table to direct these funds. So when you are introduced to the council today, when you hear about the talent that has been accumulated for this group, you're going to hear about folks who've been appointed by the Senate President and by the Speaker of the House. You're going to hear about people who've been appointed by the governor. You're going to hear about people who have been appointed by municipal and county officials. You're going to hear about people who've been appointed for my office, who represent agencies, who represent those individuals who have lived experience, those individuals who have worked hard to ensure that there's a connection for people who are in need of some support and relevant providers. Across the state, these are the people who have been working, who are going to continue to work, and who are now going to be in a position to help direct these time-limited but not insignificant resources out across the state. Let me talk a little bit about my office. My office, the AG's office, will receive about 20% of the funding over the next 18 years. There's going to be work to try to collaborate with the Maine Recovery Council, with the legislature, with the executive branch. The resources that come in are going to be nimble. You don't have to wait for the legislature to pass a bill. You don't have to wait for a grant, for a federal grant to be issued. Already, I have been able to direct somewhere in the ballpark of $6 million out. This is money that's been received from the opioid settlements and some other settlement monies that the office had to support the Mills administration in the expansion of the options program, to be directed to DHHS to use for some of their substance use programming where their federal funding was about to dry up, to continue important programming that they had going on. In addition, we have some money that's parked for if the judicial branch does expand its family treatment drug court dockets. There's an opportunity there as well. So that money isn't sitting there, it's going out as appropriately as it can. But something else I want to highlight is that this is time limited. And when you're thinking today about what it is that the Recovery Council is going to do, what it is that my office will end up doing, keep in mind that the coordination is not only important, but also recognizing that this is a limited opportunity. Even though it's over 18 years, these are limited funds. $230 million, it's a lot of money over 18 years, don't get me wrong, but that alone isn't going to get us through this crisis. And so, please keep in mind that spending the money appropriately, taking full advantage of the opportunity is of the highest priority, at least for my office. I believe you're going to hopefully hear that in what you learn about the Recovery Council. That is a high priority, I believe, for them as well. But keep in mind, too, that it can't be that money can't be alone in this effort. And so when thinking about what you hear about these settlement dollars, please be thinking about how you might work with the legislature, with the Mills administration, with our federal partners, to really augment and supplement what it is that can be done to make full use of this. And then just finally, 30% of these dollars go to the 16 counties and to a certain number of political subdivisions, of municipalities. You can go onto a website. I think the website's going to be in a PowerPoint presentation. You can go to the Office of the Attorney General website. You can click on an opioids button. It will take you to a whole bunch of information about the settlements, about the money that's going to be coming in, over what time frame, and to where it's going. Please look at what your county is getting. Please look at what municipalities are getting, because these counties and municipalities need to hear from you about what they can do to best ensure that those limited period dollars are directed in the most efficient way, hopefully collaboratively with the Maine Recovery Council, with my office, with the administration, with the legislature. So I've already spoken longer than I wanted to. You're going to hear from one of the primary drivers of this litigation from my office, Assistant Attorney General Brendan O'Neill has been one of, if not the primary attorney. Yes, he deserves this. A lot of really long days, long weeks, long years. He has worked very hard to make this a legal reality for the state. And I'm very excited as well that you're going to hear from Pat Kimball out of Bangor, which of course I'm very excited about. That's where I hail from. But she's the chair of the council. You're going to hear from both of them, and from just about all of the members of the Recovery Council who are joining us today. So please join me in a round of applause for this group and what you're going to hear this afternoon.
Good afternoon. Thank you, Attorney General Fry. My name is Brendan O'Neill. I'm an Assistant Attorney General in the Maine Attorney General's office. I am not a member of the Recovery Council. I work with the Recovery Council to help them do their job. I've been working on the opioids litigation and settlements for a little while, and I'm just going to provide context, a background, set the table for the work that the council is going to be doing. So, let's see if I can. There we go. Okay. So as you've heard the Attorney General talk about a couple of times today, our office in working with litigating subdivisions, counties, cities, and towns in Maine have been working to bring in settlements with opioid companies, distributors of opioid medications, manufacturers, pharmacies, to bring these settlements into Maine so that some of the resources that are available can be put to use immediately. Over the course of 18 years, Maine's going to see a total of $235 million. The first couple of settlements, the distributors and J&J settlements, distributors is in quotes because that's my language for the three companies that came together that are distributors, plus J&J, they started to bring in money late last year in the fall or winter, and that's when that money started to come in. The Mallinckrodt is a bankruptcy case. We'll see what happens with that. Walmart, Teva and Allergan, CVS, and Walgreens are 5 new settlements that we secured this year and are going to start to pay out later this year. So this year, the money started to come in last year. This year, more money will start to come in. The timing of the payments is significant. The Attorney General's talked about the money coming in over 18 years, but it's not equal payments over that 18 years. A couple of these settlements are designed to front load a lot of the money so that the work that is happening in this room and around the state can be accelerated. Also, other of the settlements will pay out in a steadier stream over the course of that 18 years. I say 18 years because that's the longest time frame. Some of these will pay out over a shorter time frame, and once those are done, those payment streams end. I want to highlight the J&J settlement and the Walmart settlement. Those both accelerate the payments effectively into this year. Both of those will provide substantial payments right away, and the rest will pay out more gradually over time. The settlements encourage states and litigating counties, cities, and towns to enter into agreements about how the money that's going to come from the defendants will be allocated within the state. We and every other state entered into those kinds of agreements, and this is how it worked out in Maine. So the allocation in Maine, according to an agreement, a memorandum of understanding that we entered into with the litigating counties, cities, and towns, works out to this allocation where 50% of the settlement funds will be directed by the Recovery Council to be distributed statewide. How the council will do that is part of the work that they're doing to establish their priorities, to figure out where the problem is, and so forth, and they'll talk about that. So 50% of the money for statewide distribution. 30% of the money to the subdivisions, counties, cities, and towns. There's 39 total, 23 cities and towns, and all 16 counties, and 20% to the Attorney General. And these numbers are totals over the course of the 18 years. These are the communities, sticking with the 30% pot, these are the communities that get a direct share in addition to each of the counties. Again, I'm going to move through this quickly so you can get to this group of people and they can talk about their work. This information is available on our website. On the payments page, you can quickly look up and see which communities are getting a direct share, how much they're getting, and exactly when they're getting it. This slide shows totals of how much over the course of those 18 years that 30% is going to be distributed around the state. And to explain this a little bit, what you're seeing here is a number that is allocated to a particular county, but it also includes those cities and towns within that county that are getting their own share. So just by way of example, Cumberland County, $14 million, just over $14 million over 18 years. That's a share for Cumberland County itself, as well as Portland's individual share, South Portland's individual share, and so on for the other eligible communities in Cumberland County. The same story goes for York County, $10 million, Kennebec County, $7 million. This is over 18 years. Again, on our website, you can find out exactly how much each community is getting and when they're getting it. Ideally, after this presentation, we'll find a spare table in the lobby where we'll put out a handout that tells you how much each of those 39 cities and counties and towns have now or will have by August 1st. To tell you, that there's money out there in the community. It's not just the Recovery Council. There are other resources that are out there that you can go to, and you can call these offices now, and you can ask about their planning. What are they doing with the money? How can you be involved? Who are the public health leaders that are helping them decide, where the money goes? Turning to the 50% pot, this is the Recovery Council appointees. The Memorandum of Understanding, along with recently passed legislation, creates the body of the Recovery Council. The governor gets 2 appointees, the Attorney General 3 appointees, the litigating counties, cities, and towns get 4 appointees. The Speaker of the Maine House and the President of the Maine Senate each get 3 appointees. Some of these appointees need to have certain experiences or qualifications with opioid use disorder or the opioid crisis in Maine, or helping or treating people with opioid use disorder in Maine. And in general, this is worth looking at so you can see that there are a variety of perspectives that make up this 15-person group. There's room here for state perspectives. There's room here for local leaders. There's room here for people with lived experience, people who are clinicians, people who are running nonprofits, so that the opioid crisis in Maine will be looked at by this diverse group with different perspectives. this is these are the nominees. Many of them who are here, most of them who are here. I'll put this slide back up when I introduce or turn it over to the council chair, Pat Kimball. But for now, just I'm going to move quickly past this, but I'll put it back up so that you can see who all of the appointees are. I'm going to take a minute to apologize to any of the council members whose titles I either got wrong or just couldn't fit out of a lack of space. So please forgive me. In addition to the handout I mentioned, I just want to talk about a couple of things. We'll, again, out in the lobby, we'll find a spare table, put out a couple of handouts. We'll have the one about the money. The first two here, the one on the left with the blue cover and the second one that's a document that was put together by the Johns Hopkins School of Public Health. Many of you may already know about this. You can go to the Johns Hopkins website to get it, or you can go to our website where we have it on a resources page. And Johns Hopkins put together these principles, what they recommend, what they suggest for what communities should do with their opioid funds. And very distilled, the sort of 5 high-level principles are: spend money to save lives, and by that they're saying supplement the money that is already being spent on opioid use disorder in your communities, rather than supplant money you're already spending and moving that money somewhere else. Use evidence to guide spending. I think that's probably a common idea for a lot of the folks here. I heard a really great presentation at the last breakout session about programs that are doing just that, it sounds like to me, where they're looking at not just evidence of what works, but they're looking at evidence of what doesn't work. And they're shaping their policies, their programs, their approaches, saying, all right, we know these things don't work because the evidence shows it. And here's what evidence tells us about what does work. So let's go in that direction. Invest in youth prevention. We've heard that in a few breakout sessions. Focus on racial equity. The Johns Hopkins promotes that with the concept that a lot of disadvantaged communities have been disproportionately targeted and affected by the opioid use crisis. And the last one, as the Attorney General talked about, develop a fair and transparent process. That's part of what the MOU requires for the Recovery Council. It's got to operate with reasonable transparency. It has to tell the public, about its planning process and what it's doing. It has certain data reporting requirements. I just want to be clear that the MOU requires that of the council. The subdivisions do not have a similar requirement. And so part of the suggestion of going to talk to the subdivisions, going to talk to the counties, call the cities and towns is, ask them what they're doing. You can go to our website to find out how much they're getting, how much they have now, but we don't have, and we won't be able to provide any information about what the cities, counties, and towns are doing, with their money. I suspect that some are struggling to figure out what to do with their money. I suspect others are, far along and are working to collaborate and work together to, figure out what to do with their money. It's an important point. One thing, I talk to my peers across the country, I talk to people across the state, and, we're starting to hear about, companies, for example, that have identified, that this money is out there to be spent and people are looking for ways to spend it. And they're sending salesmen around saying, hey, buy our product. You can fit it under the approved uses for the opioid funds and, it'll be this magic thing for you. If you're engaged in the planning process, you can evaluate those proposals. You can be part of the process of trying to take into account whether that kind of thing makes sense. Let's see if I can go backwards. Yes. The last handout is the one on the right. It's hard to read because it's written by a bunch of lawyers. That is what the opioid money can be used for. So as I said at the beginning, that allocation, 50%, 30%, 20%, 100% of that money has to be used on opioid abatement strategies. And that document describes what those strategies could be. It's largely a menu of the kinds of activities that need to be evidence-based or evidence-informed, but the kinds of activities that these opioid funds can be used for. That document applies to the Recovery Council. It applies to the cities, the towns, the counties. I think you'll find in there, a lot of familiarity with a lot of your work. It's broken down into two real pieces. The big piece, part B, is the full menu. And there's no requirement to do everything in there. It's just saying, here's the kinds of things you can do to treat opioid use disorder in your state with evidence-based and evidence-informed strategies. Schedule A is what the settlement encourages the parties to the settlement to focus on. So these are the core strategies that the settlement says should be a priority in the spending. And there's only 3 that are really visible on this slide, to the extent they're visible. The first one is naloxone. We've heard about that being evidence-based and saving lives. MAT, again, evidence-based. Working with pregnant and postpartum women, and so on. There are others, and so I want to highlight that document because, again, there will be handouts, but it's also, again, on our website. It's attached to the Memorandum of Understanding. You look for the MOU between the state and subdivisions. It's in there. And that's what will tell you about what can be done with these funds. And I think with that, these are the websites that I keep talking about. The first website is for the Recovery Council. They have their separate section. And you can find on there information about the members, as well as when the council's meetings are, when the council's meetings have been, every document that was presented at each of their meetings. They're also available to watch on YouTube. Thanks to fabulous staff in our office, Haley Taranko and Benedetta Pellerano, who have been tremendous at helping us get organized. The second is the email address for the Recovery Council. You can email them with your suggestions. I definitely recommend looking at the website. There's a lot on there already for your information. And the last one is the Attorney General's opioids page. A lot of these are sort of nested, but that's where you can go to find out the money. What's gone out, when's the next bunch going out, and to who is it going. And unless I've missed something, I will turn it over to the council chair, Pat Kimball. If I can back up. And there we go.
Do you want to put my slides up first?
Sure.
Do you know how to do that?
I can't, but they will.
You can, okay. Good afternoon. I always love being here at 3 because you're all asleep. But as I said, my name is Pat Kimball, and I have the honor and privilege of being the chair of the Recovery Council. And I am an appointee of the Attorney General's. And I like to tell stories, so I'm going to tell you a quick story about the Attorney General. First time I met the Attorney General was way back when bath salts hit the state of Maine. And Bangor, if you didn't know that, was hit really, really hard with that. And we didn't know what to do. We were trying to seek treatment. They weren't responsive. People were really not knowing what to do. And so Aaron came to my office and said, teach me. Tell me about treatment. Tell me about this. Teach me. And so I always was impressed with that young man who came into my office and said, I don't know a lot. Teach me more. And so I think that's what you see today is Aaron again taking it much bigger than Bangor and taking it into the state to saying we have a lot to learn. We have an opportunity to really make a difference, and we have an opportunity to really move forward. And so it's under his leadership that this council is here, and I just want to thank you. I remember that day really well, Aaron. So my name is Pat Kimball. I am a recovery ally. I am the proud daughter of a father who was 28 years in recovery at the time of his passing. I worked over 30 years in the field of substance abuse and treatment disorders and mental health, and my last job was a wonderful job as the executive director to Wellspring, which is the oldest treatment center still active in the state of Maine. And I'm very proud of the work that Wellspring did. In my retirement, I've continued my work to change policy and to continually work to move forward and to change the statistics that our people are losing their lives. And we want to make it so we talk about the people in recovery and how many people are there. And that is who I am. So before I introduce this esteemed group of people, I just want to briefly go through what sort of the role responsibility is of this council. All right, so which one do I pick? Here we go. Big green one. I'm also technically challenged, I'm old. Okay, so be patient with me. There we go. So the council was established as Assistant AG said to that, under a memorandum of understanding between the Attorney General's office and the litigating divisions, and it's under, and also state law. So there's a lot of things we have to do legally to spend this money. And so we have to follow those guidelines in order to be able to use this money responsibly and in the best way possible. The MOU charges the council with the direct reimbursement of these funds to issue statewide. That sounds easy. I can tell you it's not. All right. So the council documents that he shared with you earlier, these are our guidelines, the settlement agreements, the MOUs. Also, part of that is the school administrative unit. Part of that money has to be spent on schools, and that's part of the MOU, and the LD 1722 that guides us in the work that we do. So here are the basic functions of the Recovery Council. A needs assessment, planning, expenditures, and outcome data. It's really important for us, and again, it's a slow process. We'd like it to be faster, but we really need to know what the data is available and what the data is showing us that we have. What are the gaps in this state? And that's a wide range. Where are those gaps? Who do we need to talk to? How do we get that? And also, when distributing these funds, we need to know what the outcome based of distributing them will be, and we have to keep track of that data to show you that the money that we were entrusted went to prevention, treatment, harm reduction, recovery. All right. The obligation of this council really is about transparency. As the Assistant GA said to you earlier today, we are open. You can listen in on any of our meetings, all of our meetings. The public is invited, whether that's online or YouTube. All of the information that we dispense during those meetings has public access, and we want you as the public to be able to do that, including, again, we have an email address where you can send your questions or concerns, and someone will respond to you in a timely manner. We really want this to be a statewide effort, not the wishes of just the 15 people that are part of this committee. We have a public dashboard, and the biggest part is about collaboration. As we shared, we're not the only ones that are distributing money. There's the counties, there's the schools, however that works. We want this to be in a collaborative effort. We don't want to work in silos. We want to be able to enhance programs. We don't want to duplicate things unless it's in another part of the state. Like Portland has something that's working. Will that work in Aroostook County? I don't know, but we're going to find out and look at it. So where are we to date? So this is just sort of a brief thing. The first time we ever got together was in November of 2022. We got to know each other and introduce each other and learn all about our responsibilities and how this money was being distributed. We established a meeting. We have a regular meeting. We meet monthly, the second Thursday of every month. And again, those are public. We establish bylaws, so we have guidelines that we know that we can abide by. We elected offices just this past summer. We have established subcommittees. Those subcommittees are finance and grant and programming and governance. So we have those established in place. And we're working on the final draft for a conflict of interest policy because you know well in Maine, the degree of separation is not large. So we have to make sure that we look at conflict of interest and we address those issues as they come up. So what have we done so far? Besides what I've shared with you, we've asked the department to come in and show us their data, to show us where they are, where our treatment's located, how many are them there, what do they see as gaps. As a matter of fact, they were just there. Director Squirrel was just there sharing with us some of the things that they would like to see some of the funds going to, some of the programs that they didn't have the funds to disperse to, and maybe we could piggyback on some of the work that they're doing. So it's a great relationship. They came. We also had the National Academy for State Health Policy actually talk to us because we're not the only state that received money. So this is the organization that can share with us what other states are doing with their money so we can look at. I will tell you, one of the things that I learned in being part of these calls, these national calls, is where Maine does really well at, and I really love what they did. One of the things that you often hear other states complain is they can't seem to get people with lived experience to be part of the process. I don't think that's the problem in Maine. I think that we have some amazing advocates in Maine that are advocating for recovery and treatment and harm reduction and prevention. And they're at the table. And you'll see that as people introduce themselves, that we have people here with lived experience. I think part of that is with the opening up of so many peer recovery centers that we've given people in recovery a voice. And so that voice is used in Maine. I was very proud. I shared that. Again, we have the monthly calls with national, and in August, a few of us will be attending a national conference, and luckily it's in Boston, so it's not expensive, but it's a one day where all the states will meet for a day to talk about what they're doing with their satellite funds and what's working, what's not working, and be able to meet and talk with other people and to learn. So I think that's a good thing. And I'm going to leave that there. So that's who I am. That's who the council is. And at this point, I'm going to ask the council members to introduce themselves to all of you.
Good afternoon, everyone. My name is Joe Everett, and I'm the CEO at the Opportunity Alliance here in South Portland. And I'm a member of the council, and I was appointed to the council by former Speaker of the House, Ryan Fecteau.
Hello, everybody. My name is Bruce Nodden. I'm with the Maine Reentry Network, which used to be called the Maine Prisoner Reentry Network, and I was appointed by Senator Troy Jackson.
Good afternoon. My name is Eric Small. I'm the Deputy Police Chief of the Sanford Police Department. I'm a representative of the municipalities and counties, and absent today, who I'm also going to introduce, is Sheriff Todd Brackett from Lincoln County, a colleague of mine. He wasn't able to attend, but he is also on the council. Thank you.
My name is Paul Vinsel. I was appointed by the Attorney General Fry. I'm a physician treating addiction medicine at Tri-County Mental Health Services with a long history of emergency medicine. I hope to bring those experiences to our decisions in the council.
Good afternoon. I'm Miles Willett. I was appointed by Senator Troy Jackson. I'm someone in long-term recovery and someone who is directly affected by these pharmaceutical companies and the opioid epidemic. I'm a clinician, substance use clinician, and a clinical supervisor at an outpatient treatment facility here in Maine, and just anxious to put in some work to get this money out to Mainers and save some lives.
Good afternoon. I'm Representative Lydia Crafts. I have the honor of serving House District 46. I'm also a clinical social worker as well as an affected other, having lost a loved one to the opiate epidemic. I was appointed by the Maine Speaker of the House.
Hello, my name is Liz Blackwell Moore, she, her, and I am the Director of Public Health at Cumberland County. And I was appointed by the subdivisions, that's the municipalities, so cities, towns, and counties. And I have spent my career started in harm reduction, working in prevention, and working in public health as supporting communities and organizations to use trauma-informed equity lens for solving really complex problems like substance use disorder. And I hope to bring a focus, really ensuring that not only are we focusing on people, individuals who have been impacted, but also children and their communities that they live in who have been seriously impacted by this opioid problem, and so that we can prevent future substance use disorders. Thanks.
Hi, my name is Kina Thakrar. I'm an infectious disease and addiction medicine physician in the Portland area. I'm also a researcher and principal investigator of Project Dharma, which is a federally funded harm reduction grant. I was appointed by the President of the Senate, and I'm really just honored to use my experiences as a clinician and harm reduction researcher to serve the council. Thank you.
Hello, everybody. My name is Courtney Gary Allen. I'm the organizing director of the Maine Recovery Advocacy Project. I also have the honor of serving my community of Augusta as an at-large city councilor. I was appointed by AG Fry in the seat of lived-in living experience of substance use. I am a person in long-term recovery, and I also love many people who use drugs. I am very committed to the reason why I wanted to serve, especially in this first reiteration of the council, is that I'm deeply committed to the transparency and process in which this council decides on what is going to be spent. I also am going to introduce Chastity Toole. She sends her apologies. She's all the way up in Washington County, serving her community, doing outreach with people who use drugs. So Chastity Toole is the Northern Maine Director of Harm Reduction Services at Maine Access Points. She's a person with lived experience who was appointed by the Speaker of the House to represent the harm reduction community in a seat that was added by LD 1722. As a lifelong resident of Washington County and a boots-on-the-ground harm reductionist, she is honored to represent and bring the voices of people who use drugs in rural Maine to the table.
Good afternoon. My name is Benjamin Mann. I'm the Deputy Commissioner of Finance at the Department of Health and Human Services here at the state of Maine. I'm an appointee of the governor, and I'll pass it over to Gordon.
Thank you, Ben. Gordon Smith, I'm the state's director of opioid response, and we work at the Governor's Office of Innovation Policy and the Future. Nobody's introduced Betsy, have they? No. So our 15th member is Betsy Fitzgerald. I do know that. I'm getting tired. You're wearing me down. So Betsy is the retiring county administrator in Washington County. She's very well known among the county executives, and has been making the long trek down from Machias. Really a wonderful addition to our 15-member council. Yeah, you do now, unless you give something else going on. We can keep it.
So we have some time. So is there some questions you have of us that you'd like an answer to? And we'll see if we can answer that question for you. Either raise your hand or speak. Oh, right here.
We can run a microphone around.
Yeah, hold on. Thank you.
Yes, my name is Catherine Holloway. I'm a clinician and a psychologist. I work in Augusta. And I'm wondering if any of these monies will be able to go for recovery housing. That's a very strong shortage. And we have a clinic where we provide services, and we really are struggling deeply with housing. I see it as a very strong harm reduction potential. Thank you.
So, does someone want to answer?
Is this mic on? Yeah. The answer is yes. Recovery housing is one of the options on the list of things that this money could be used for.
Good afternoon, everyone. My name is Mark Lefebvre. I'm Director of Community Engagement at Pine Tree Institute. And we've been recently awarded the Recovery Friendly Workplace Grant. And one of the questions I had was, first of all, thank you for the opportunity to lead the statewide effort. The initial investments are going to be primarily used to establish a statewide capacity for common designation criteria, trainings, things of that sort, develop a website, marketing, branding, logo, those types of things, which leaves little, if any, money left over to actually address the roles and the resources that we'll need in the community, specifically what we call recovery advisors that will provide outreach to businesses, as well as recovery advisors, which will be providing peer supports. And the question I have is whether or not there'll be consideration for funds at the community level so that we can have those two-in-the-box resources to help us scale statewide.
I would be happy to take that. Recovery-friendly workplaces is a really important initiative. The governor and the state have really supported this. The Health and Human Services Committee has made this a priority. And so making sure that that program is comprehensive and successful is really important. And I think that it's an important priority for the council to consider.
Hi.
Hi.
I'm Scott Hansen. I practice in Lewiston and live in Yarmouth, and I wanted to thank you all. I also wanted to put a plea in for cross-county and cross-jurisdictional coordination. I tried to volunteer as a physician wanting to help during COVID, and I was struck by how challenging it is for government health agencies and private health agencies to work together. And the pandemic is over, but the other epidemic is still going on. So I'm not sure exactly what that looks like, but I know that county health departments all over this state are, some of them are barely in existence right now. So please keep working that silo breaking down.
I thank you for that. And it's one of the challenges that the council has talked about is to how do we reach out to the municipalities and the cities so that we can all work together. And we know that Maine is distinctive. Depending on what part of Maine you live in, there's certain gaps in different places, and there's sort of cultural differences that we have to look at. But we do have to find a way to communicate. And that's one of the challenges that we see, and we see, I think I can speak for the council, we see that we have a role in that. We just have to figure out what that is. But I think that we are a good group to be able to bring together the municipalities and the cities and the towns to be able to talk about what we can do, because this certainly hits in every aspect of our lives. So thank you for that comment, sir.
Hi. Hello. Chris Hall from the University of New England. Thanks for being here, and thanks for your service on the committee. I know that there are a lot of very large initiatives that are going to need millions of dollars of support from this committee, but I would encourage you, when you look at your grant structure, to make space for small innovative projects from students, not just high school, but also like college students, because we have some great students at UNE who have been working on harm reduction kits for people leaving the Cumberland County Jail, and I'd love to be able to support them through this process. But thank you.
I think a very valid point. One of the pieces of how funds can be spent certainly is about youth, but part of it is also to expand workforce development. And what better way to expand workforce development but to tell young people what a wonderful career this is, and how you becoming social workers or counselors or job coaches, whatever that is for people in recovery, those are important jobs to have, and it's a way to connect with them. I don't know if anyone from the committee has...
Pat, can I talk to that, Pat? I'm behind you. Hi, Pat. I really appreciate what you just said, and I know that Courtney and I had a conversation about this very thing when when the legislation was being established and this idea of a recovery council came about was that, we're both, and some people up here are we're parts of small nonprofits that are growing, and we're, in our case, we're not that tiny little nonprofit that's wondering how you get those millions of dollars. And there are so many folks in this state that have wonderful ideas, and they just don't know how to get there. And I will tell you, I can only speak for myself, but as a member of this council, it was only 2.5 years ago, that our organization had no funding. And we were all volunteers. And I understand what that looks like. So when we're looking at things, I'm going to have my eyes and my ears and my soul wide open to this idea of really good ideas at the community level, that even just a small amount of money could push them to a point where they make a real difference. So I hope you'll encourage your folks to continue doing that, and I hope that there will be funding available for those folks.
Yeah, I think it's important to think big. It's also important to understand that, just like Bruce said, small projects can make huge differences. And I think that's important for us to remember. Sometimes a $5,000 grant or a $10,000 grant can do miraculous things. And so we always have to sort of keep that balance in mind. And we also have to understand that there is reporting requirements, but they can't be so huge that small organizations aren't able to report back on some of the work that they do. I worked for a small agency, so when I applied for grants, it was always important to know, can I keep up with the administrative burden that comes with that? So I think that's part of our responsibility up here to do that. I will tell you, I've worked in this field way too many years. It's the first time in my life I had money to spend. I was always begging for money. So this is sort of a unique position for me. Other questions? Erin?
Hi there. My name's Leona Lavoie, and I'm the director of a Healthy Community Coalition in Franklin County. And I just want to add to that, I have a question, but I would partner with your local public health agency or coalition, because they might be able to write in funding to support the students doing harm reduction kits. So my question to the council is, and I'm super excited, this is an amazing group up there. I know quite a few of you. Is there going to be any discussion or guidance on what percentage of funding will go towards prevention, treatment, recovery, harm reduction? So we've got this bucket of money, and how will we make decisions to make sure we have funding across that whole continuum?
Anyone want to take that question? So that is the huge challenge.
Well,
we'll give it to Gordon because he's overtired.
In the same way that we have kept track of that with the help of Director Squirrel in terms of our own strategic plan since 2019, we try to see what resources are going into each of our 4 focused areas, and that shouldn't change. There's a tremendous array of talent and interests. I mean, we're all interested in prevention. I mean, I thought I'd be the one to address this. The theme today, I remind you, is the power of prevention, and having fewer, if we're successful in those areas, then fewer people we'd be able to dedicate more resources to the people who we've not been successful with in preventing their substance use disorder. So while I don't see that we would probably have a hard and fast rule that said, okay, we're going to put 20% here, 20% there, 20% there, because maybe in a given year the urgency is absolutely treatment. Maybe another year it's really absolutely harm reduction. But we will certainly keep track of that. And I think everybody, all 15 of us, are very committed to making sure that all those areas are covered. Because unless we're successful in all those areas, then we're not going to be successful in the long run.
I think that's been our challenge. It's about collecting the data to know what's going on right now and where are those gaps. But again, I think we will look at the whole picture. And as you can see by the group, they're diverse enough. They have really good voices. So it's a good group to work with.
Pat, could I just jump in on that for 1 second? Thank you. I think that it's important for the audience to understand that many of those decisions have not been made yet. that this council is in the process of making those decisions, as well as that no one individual member of the council speaks for the council. And this council is a phenomenal group that's coming together to make those decisions together. But I think it's really important that as people of Maine, that you are in contact with this council about what your ideas are and what you think this money should be used on. I know for me, and maybe I do speak for the entire council on this, I know that we all deeply care about Mainers and about how we are going to come together to make these decisions. And while $14 million this year and over $100 million over the next 18 years feels like a lot of money when I say it out loud, because I grew up super poor and that's a lot of money. But in the reality, it's not that much money in the context of how much need is in our communities. And that's why I think Pat talked a lot about, and AG Fry talked a lot about, how are we going to partner with all of the money that's coming to Maine, and how are we going to ensure that all of these needs are met?
Thank you.
Hey, how are you?
I'm fine, and you?
I'm good. I'm Representative Annie Graham, and I represent House District 105, which is North Yarmouth and Gray. And my question is and a suggestion, is how we help the counties make this happen. Being in a smaller town in Cumberland County, we have Portland's bag of money. Sorry. and then we have Cumberland County. And so my concern is those little places that are maybe unrecognized, where they may need some help. So my suggestion would be, you're going to be meeting with other states, and many of the other states have a much stronger county government system than we do, and developing some type of template to kind of help the counties be able to reach out to those smaller communities that may get lost in the shuffle as we did this really good work. And lastly, thank you. I've been anxious to meet you all. I sit on the Health and Human Services Committee, and we've been dying to get this work going. And many of you I know, and thank you for your work, and it's so important.
And we did get your letter from your committee, and we'll look and saw that your priorities for Health and Human Services, and they're wonderful. Thank you, Pat. I think.
Yeah, I appreciate the question, and I think I have a quick answer for Cumberland County, and then also some thoughts on the state. I think I work at Cumberland County government. We're the only county that has now a new public health department, and so I think part of our role is supporting the towns and in coordination of some of the work that they will do with their funds. We are in the process of having those conversations. And we are trying to create our own transparent process for Cumberland County of how we hear from and work with the community to figure out what we should be doing with the funds that the county received, but also then coming together as a whole county, not just the towns that received the money, but the ones who didn't, to say, where are there those gaps that still exist, and how can we support organizations or towns, or look for the funding for ourselves to then use, really apply for additional funds to support that. And I think that there is a public health infrastructure that really does want to support the towns and counties and organizations to do this work. So my hope is that there is some reaching out to those public health organizations that exist, like the one that Leanna works for. And there are folks in Midcoast, there are folks in Washington County, there are public health folks that can be helpful to the counties and the towns for figuring out what to do with this, because they don't have a public health department, or they don't have a public health person within their organization. So I think that's a thing that we have to continue to work on, and that I know the council wants to support that coordination and support to those organizations and towns.
Another question?
Yes, hi, I'm Kristen Sylvia. I'm an addiction medicine provider in Portland. And I guess my question's around time frame and process for the money that you folks are responsible for. Can you give us some idea of when you think the process by which those who do the work might be able to submit requests for proposals, or what's the vision for that? Just some specifics.
So that is the million-dollar question. We are hoping to again, we are getting ourselves structured. We are looking to make sure that when we do RFP or do start advertising or looking at requests, that we do this in an organized way that's fair to all. I would love to ideally say that by the end of the year that we would start this process. They're shaking their heads. I'm not being too ambitious. So I'd like to say by the end of the year, but whenever it is, we are going to try to do it as quickly and efficiently as possible. But again, we don't want this to end up in appeals court somewhere because we missed a step. We want the funds to go where they need to go, and we need to be responsible. So that's the only piece. I can tell you that this group is very impatient about wanting to get the money where the money needs to go. But they also know at the same time, slow but steady is my thing. I'm the turtle. Slow but steady wins the race, and so that's where we are with that. But everything will be public, everything will be posted when those grants and when those dollars, and again, don't hesitate in the meantime to reach out, ask us questions, tell us concerns, because we can look at that.
Dr. Sylvia, I'd like to respond to that a little bit. As an emergency physician, I expect everything to be done immediately. And if it's not, I get upset. And it has been a little frustrating being on the council, but I've learned so much, and I thank so much Assistant Attorney General O'Neill to leading us to make sure we do things the right way with transparency so that it will meet the requirements. But it's a slower process than I think any of us wanted, and it is a little bit frustrating. We feel the same way.
So I think we have two more questions. If we can do one right back here, and then I have one here, and then we can tie it up.
Okay, because people are coming in. Yeah, got it. Another question.
Can you hear me now?
I can.
My name is Elizabeth Wise, and I am a woman with 19 years of long-term recovery and a certified addictions nurse, an RN. And I live in Oxford County in Norway, Maine. I'm curious to know, first of all, this council is awesome and I would love to be on it, but in the meantime, I'll ask this question.
We have term limits.
Yeah. I will support you however I can. How do you determine the towns within the counties for the allocation of funds? For instance, we saw that Oxford County is getting $2 million, which is more than zero, and did not notice any of the towns within Oxford County listed. I could be wrong, but we're curious to how you determine those towns. Oxford County is drowning, dying, and we would be interested in your response. Thank you.
I think the AG can answer that question.
Yeah, thank you. So this was determined by the settlement itself. So what happened was there were a certain number of litigating counties and municipalities. I think it was 12 of the counties and some smaller number of the cities and towns. So they receive a share directly. And then the way in which this worked out from a national standpoint is any municipality that was over 10,000 but was not litigating would also be a direct recipient should they agree to that. So what you see in Maine are every county has more than 10,000. So all 16 counties, whether they're litigating or not, they're over 10,000. So they all get it. Any litigating municipality, I think there's only like one that was under 10,000 or two that were under 10,000. And then, like the city of Westbrook comes to mind. They didn't litigate, but they had more than 10,000, so they got it. So that's how it was determined which municipalities or counties all counties specifically got it. And you can find those specific municipalities, like you saw up on the board there. You can see those online. We got one more question, Gordon, and then
one
we're going to
one
wrap
more
it
quick
up.
question.
Hi, I'm Jeanette Dosova, and I am a program director for Westbrook Partners for Prevention. And so much of the funding that we receive is age restricted, so 12 to 20, 12 to 18. And with working with youth, that's also feedback we receive from them that, some of the programming and initiatives that we implement would be better if it started earlier. So my question to you is, do you have that plan for some of this funding to start earlier than 12 years of age?
We don't have that plan, but can I make a suggestion? If you could place that in an email to us to share with us that concern about that gap and where that gap in funding is, that I think would be very helpful when we get to that point at looking at how to distribute funds and where to look at. But that's what we are right now. We're really gathering data about gaps and things like that. So if you could email us, we can add that to our information list as we continue to explore that.
And
Miles got one thing.
Just to add on that, all of you folks are working with folks in recovery. You're all experts in your field. So again, I just want to reiterate, we want to hear from you. We want to hear where the gaps are. We want to hear what's going on. A lot of us were working in this capacity, and we somewhat know, we don't know everything. So please check out our website, send us an email, let us know what's going on in your communities so that we can better serve you folks.
Very well said. Thank you. Because that's what this committee is. Thank you all for your attention today. Thank you for your questions. Please explore our website and we look forward to hearing your response and look forward to a plan that goes into place. Thank you very much.